dàgbà bí ṣe kúlé ọmọ àríjó ṣe bí ọba. Ṣàkàṣìkì ní dàgbà bí ṣe kúlé ọmọ àríjó ṣe bí ọba.
All right, so very good ladies and gentlemen and fellow women of honor. We'll be bringing up stage to officially declare this conference open, the chairman of today's occasion. And by the time we hear the citation of the chairman, we will know that indeed somebody fits for this occasion. Is somebody who has good pharmacy practice, from practice to policy, from counter to impact. So please, yes. From counter to impact, and from routine to transformation, is a name we indeed cannot ignore in this profession. And before Mr. Chairman speaks, ladies and gentlemen, we'll be having a fuller citation of Mr. Chairman on the screen. Please, we would like you to fix your gaze on the screen as we read a fuller, a concentrated citation of Mr. Chairman. And after that, Mr. Chairman takes the center stage. Thank you very much.
Am I yọnu sí mi? Àgbàtọ̀mọdé ẹ máa yọnu sí mi o. Ọkùnrin tóbìnrin ẹ yọnu sí mi. Ẹni bá yọnu sí mi. Ṣọ́jú ìyọnu Ọlọ́run ọba, ìyọnu Ọlọ́run ọba, ìyọnu Ọlọ́run ọba, ìyọnu Ọlọ́run ọba, ìyọnu Ọlọ́run.
Oladigbolu Adewale Aderemi, FPSN. Few healthcare leaders have demonstrated the capacity to transform vision into national impact as remarkably as Oladigbolu Adewale Aderemi, FPSN, a distinguished pharmacist, healthcare strategist, policy advocate, and transformational leader. He has consistently championed initiatives that expand access to quality healthcare, strengthen pharmaceutical practice, and improve health outcomes for millions of Nigerians. Currently serving as Senior Vice President, Market Access at Advantage Health Africa, Adewale leads strategic initiatives aimed at delivering more health to more people through innovative healthcare financing, digital health solutions, market expansion, and healthcare accessibility programs. His leadership continues to bridge the gap between healthcare innovation and the communities that need it most. A fellow of the Pharmaceutical Society of Nigeria, FPSN, Adewale has built an extraordinary career spanning healthcare leadership, pharmaceutical practice, healthcare policy, market access, and public health advocacy. His influence extends beyond organizational leadership into national health policy development, healthcare financing, universal health coverage, and pharmaceutical sector reform. As National Chairman of the Association of Community Pharmacists of Nigeria, ACPN, from 2021 to 2025, he spearheaded some of the most innovative and impactful initiatives in the history of community pharmacy practice in Nigeria. Under his leadership, Nigeria witnessed the national rollout of COVID-19 vaccination services through community pharmacies, the deployment of electronic documentation systems for community pharmacists, the launch of a national pharmaceutical supply chain platform to promote medicine traceability, and the establishment of a national cooperative framework to strengthen the economic capacity of pharmacists across the country. His contributions to healthcare policy have been equally profound. Adewale has served on several national technical and policy committees, including the Federal Ministry of Health's Task Shifting and Task Sharing Policy Review Committee, the National Primary Healthcare Development Agency's Technical Working Committee, the National Health Insurance Authority's Operational Guidelines Review Committee, and the NAFDAC Traceability Steering Committee. Through these roles, he has helped shape policies that continue to influence healthcare delivery across Nigeria. Widely respected for his visionary thinking, Adewale conceptualized and implemented the Community Pharmacy Expansion Scheme, an ambitious initiative designed to establish and sustain community pharmacies in hundreds of underserved local government areas across Nigeria. This groundbreaking effort reflects his enduring commitment to healthcare equity and universal access to pharmaceutical services. Throughout his professional journey, he has remained a passionate advocate for innovation, professional development, and public health advancement. His leadership has facilitated partnerships with international organizations, strengthened healthcare systems, expanded access to essential medicine, and elevated the role of community pharmacists as critical stakeholders in Nigeria's healthcare ecosystem. Adewale's outstanding contributions have earned him numerous recognitions, including the Fellowship of the Pharmaceutical Society of Nigeria, the Award of Meritorious Service, the USAID Award of Excellence, the Healthcare Providers Association of Nigeria Award of Excellence, and special recognition by the Lagos Chamber of Commerce and Industry. These honors reflect a career defined by service, innovation, integrity, and impact. Today, Oladigbolu Adewale Aderemi stands as one of Nigeria's most influential pharmacy leaders, an advocate for healthcare transformation, a champion of professional excellence, and a visionary whose work continues to shape the future of healthcare delivery in Nigeria and beyond. Ladies and gentlemen, I present an exceptional leader, a healthcare innovator, and a distinguished professional whose legacy of service continues to inspire generations. Pharmacist Oladigbolu Adewale Aderemi, FPSN, immediate past national chairman of ACPN.
Thank you so much. Having spent all this time rolling out these things, I wonder whether there's any need for me to say the other thing. Alright. But I must start by paying true allegiance to the land of the birth of my mother, Ibadan. Ibadan, Ọmọ Adúrósù. Ibadan, ìlú Olúyọ̀lé. Ibadan, ìlú Vanguard Pharmacy. Ibadan, ìlú Bakaya Pharmacy. I can go on and on. There is no place I've not been in this country. But what surprises me most is that there is no place they practice community pharmacy like Ibadan. One of my mother's children is there. Alhaji Rahman, you are making phone call. Please stand up for recognition. That's my mother's child, my mother's son. There is no Christmas it won't be in my home, even while I was in Port Harcourt. And we started this thing together. And when I was pursuing how can I make community better, he's busy developing my people, servicing them, and growing his business. And that's why I say again, I don't think there is any place in Nigeria where they practice pharmacy like Ibadan. So once again, I'm at home, and I'm happy to be with you on this very, very important occasion. One of the things that I'm fond of doing is to celebrate excellence, and I can see that excellence reflected here today. I've seen what pharmacists are kind of packaged together. A very, very good conference. Even though the attendance is not as much as I expected, but nonetheless, that will not take anything away from what we are going to hear today. I've monitored pharmacists for some time, and sometimes I look at him and I think it's like me and this guy resemble each other a bit. But in terms of intellectual capacity, I would say just wait for him. Here is a man that has traveled the length and breadth of pharmaceutical practice in Nigeria, head of an international organization of recruits. And so when he will deliver his address today, I will urge you to do one or two things. Bring out your parts, bring out your Bible, and put down the ones that you apply in your practice. It's going to be a long day, and I have decided not to look at my prepared speech because the lecture has really eaten deep into our time. But before I will sit down, I would also like to celebrate the people who have come before me. All the fellows of Pharmaceutical Society of Nigeria, may you please rise and be recognized. I'm using Pharmacist Anthony as a point of contact to all of you. And ABO, Pharmacist Anthony Oladigbolu, welcome, you are welcome. Welcome to this land of my mother's birth. Please, you can take your seat. I would also like to specially recognize the man they said is retired, but is not tired. That's the chairman of the Pharmaceutical Society of Nigeria, Oyo State, Pharmacist Ajanaku. I'm thank you so much for what you are doing. I've called around this country. I've not seen a secretariat like that, Pharmaceutical Society of Nigeria, in Oyo State. Thank you. Thank you so much for what you are doing. Thank you for your great leadership. The man that will soon join me in about 13 months' time, I need to celebrate him. Pharmacist Ambrose Igwe-Kangwa, please stand up for recognition. He will soon join the League of Retired Leaders, but currently is our national chairman and is doing well. And the vice chairman is also from this state. Please stand up for recognition of the vice chairman. Thank you. If you have a chairman and you have a rancorous vice chairman, you will know. But these ones, they are not rancorous. So I celebrate you. I will always celebrate excellence. So one more time, please permit me to celebrate the Gbadamosis in the house. Alright? So one Gbadamosi handed over to another Gbadamosi. Immediate past chairman of Oyo State ACPN and then the current chairman. Please, we like you. We love what you are doing. We love the cohesion. We love the force of impact that is moving. And I will not stop celebrating without celebrating the federal government of Nigeria. This year's state officer, please stand up for recognition. The other time when they mentioned your name, you did not sign up. So, if our practice is on upward swinging on your state, who do we have to thank? Council. If it's on the lower side, who do we blame? You said it, or it's not me. I've not said anything. So thank you so much, and by the special grace of God, we are going to have a nice conference, and by the power conferred on me, without wasting so much of the time, I hereby declare this conference open. Thank you.
Then go for sun go shine, we no go tire. Night go come, they go break, we go see the dance, be your bar. Show up, Baba, Jaway, Talon, Pajaleku, it's 40, no shadow, go to him, no shun no man. Adikuna master, I love it. God don't promise me, say, no story. Oluwa ti ṣe mi la oni yo si lakushi. From nothing to some, lakushi. From primary to second, lakushi. From the street to love, lakushi. I go give God the glory. That's for me, I'm okay. That's for me, watch it. A brand new life, and one more day, hope you do that. Rock me up, I should have been. My job, you're back.